Hi guys, my name's Alana. Welcome back to my YouTube channel, Mental Health with Alana. If you're new here, please click that red subscribe button and give this video a thumbs up. If you're wondering about my business, I sell care boxes, which are sensory boxes for your mental health. You can get these on my store. My link for my store is in my link tree. And I also have social media like Instagram and Facebook for my care boxes if you want to check them out as well. I ship within Australia and also overseas, just depending on what country you're in. But yeah, if you want to check them out, then they're there for you as well. For this video, I want to talk about my experience being in a private psychiatric hospital and the differences between private and public, and just a couple of things that went along with it. So the first thing that I wanted to explain is why I went private instead of public. So the first reason is because with the public system, especially where I live, it's very like a small town, like rural. We're still considered like a rural town. And there's only one private psychiatric hospital and like one kind of public psychiatric hospital. The public hospital is extremely small. It has very limited beds, so it's very hard to actually get a bed in there. And I have been to emergency plenty of times with quite severe mental health issues, and they have still never put me in hospital. I think the last time before I went into the private hospital with this last admission, which I'm going to talk about, I think if I had gone to emergency though at that point, they probably would have put me in the hospital because I was like really psychotic and wasn't functional whatsoever. Like I was, you know, delusional and things like that. Now, the difference mainly is that the public hospital is obviously run by the public hospital. So they have their own set of nurses, doctors, psychiatrists, mental health team. With the private hospital, you need to have health insurance or DVA. So DVA is like if you've been in the army or if you're currently in the army will pay for, basically they pay for all medical expenses that you have, even when you're out of the army. The other option to go into a private hospital would be that you need to have private health insurance. So I don't have private health insurance, but my parents have it, and my name is still under them. Even though I'm an adult, you can still be under your parents, because I can't afford that. So I'm under their private health insurance, and that means that I'm able to be admitted privately because the insurance will pay for it. The other reason why I didn't go public was, apart from there not really being beds available, the other reason is that at least the one where I am, I don't know about other ones, but the one in my town has not had a good rep whatsoever. There has been numerous things that have gone wrong in there that shouldn't have ever happened. They're understaffed. They really just, it's really not actually safe, in my opinion, to be in there, which it's meant to be safe, but it's not. I even had a nurse tell my mom in private one time when I was in the ER, like the emergency department. She went like out of the room or whatever that I was in, and the nurse like told my mom, I was probably around like 20 at this point or something, and my mom, the nurse told my mom, you don't want her to end up in there. So even the nurses know that it's not a great environment. It is extremely triggering, and I'm not basing this on my own facts, but I'm basing this off my friends and people who I know have been in there, and like reviews of the place and stuff like that. And yeah, it just hasn't gotten the best rep, I suppose. So that's another reason, is safety. And then the other reason is because my psychiatrist works at the private clinic, so at the private hospital. So if I went into the public system, she would have no say over my treatment. She wouldn't be in charge of my treatment. I would have a whole set of new doctors, new psychiatrists, new nurses who don't know my complex mental history and past, which my psychiatrist, I've been with her for almost 3 years, and I've been to that the private hospital many times. They have a lot of files on me and records that they can pull up. So it makes more sense to me for me to be admitted privately where my actual psychiatrist is, so I can see her, you know, every day or whatever it is, to have her do a treatment plan for me. Other than instead of just like some random psychiatrist having to kind of start from scratch. And with the place I was in, there was no way that I would be able to communicate clearly what was actually going on in any of my history by that point, because I was that like psychotic and unwell. Like I wouldn't be able to communicate like that. So that's the reasons. Next is an answer that I get all the time based off a TikTok video I put up on YouTube, where it's like a day in the life of a psych ward patient. Now I have a lot of comments, a lot of rude comments, number one. I don't know why people are so mean and rude. I don't understand. It's just that particular video, and it's literally like 15 seconds long, or like 10 seconds long. But anyway, people love to say, why are you allowed your phone? Why are you allowed to do earplugs? Why are you allowed this? With the private hospital, you got to sign a piece of paper before you go in, stating that you will not break any of their rules. They list all their rules and regulations. If you do break them, they say that they can kick you out, or they can ring the police or the ambulance and take you to the public hospital. So they do try to be as lenient as possible. Like, I broke a few rules and did some things that I wasn't supposed to be doing, and they did give lenience, but they did say, like, if you continue this behavior, if you continue doing this, we can't have you here because it's triggering for other patients, or, you know, it's not safe for you, or whatever it is. So yeah, they will intervene. The other thing is that they have to know you are allowed things, but when you come there, they do a bag search, and they can search your room at any time. I had a room search one time because I did something and they had to check my room. They have every right to do that. They can take belongings off you. They can take anything they want off you. They can do like checks where it's like every 10 minutes they check on you. It all depends on what basically you're allowed things depending on your risk, your history, and your situation. So every single person has a unique treatment plan that your doctor comes up with, and you are allowed things depending on what they think is safe for you. And if you do something with those things, they will take it off you. So I had items taken off me at some points when I was really sick because they were putting me in harm's way or whatever it was. So they will intervene. They're not just gonna, you know, let you do things. It's not a locked facility. The public hospital is locked. But within the private hospital, there's a notebook thing. You have to write every single time you go anywhere. Even if you're going to a room within the hospital to do like a group session, you go to eat lunch, you go to sit outside on the steps to have a smoke, you go to the smoke, they have a smoker's hut as well. It's like, and a garden out the back. If you go to the garden, if you go to the smoker's hut, if you go to the lunch thing, basically if you're not in your room and you're not in the common room, which is right in the nurse station, you have to write where you are. If you don't, they can call the police, they can call the ambulance, they can come, basically they'll go find you and send you off to acute, which is the public hospital. Now, so that kind of answers the questions of why are you allowed your phone and stuff like that. You are allowed that. Even in most public hospitals, you are allowed your phone. So I'm really not sure why I've had so many comments asking me why are you allowed your phone. I'm pretty sure within Australia at any psychiatric hospital, unless you actually it'd be different if you were using your phone to ring in, like, say you were psychotic and you thought that, like, the radio stations or something were, what's it called, broadcasting your thoughts. This is an example. So I have schizophrenia, so I'm just thinking of this because this could be a example. And you were ringing radio stations, or say you were really manic and you were, like, buying all the stuff with your phone, or you were ringing people and making inappropriate text messages and phone calls, or things like that. They would take the phone away, obviously. But if you're not doing any of those things, then they don't take your phone off you for the most part. And like I said, it literally depends on your situation. It will never be the same for every person because everyone has different reasons of why they're there and triggers and things like that. The hospital is extremely strict about what people can talk about. You are not allowed to bring up anything triggering, and if they find out that you've been discussing things, they will do something about it, because it needs to be a safe environment for everyone, and they can't have people going around triggering or traumatizing people that are already ill and unwell. So that hopefully will clear up those questions. Then I guess the pros of it was that I was going into hospital meant that I was safe, because prior to going in I was, like, had an active suicide plan. So going in made me safe in the fact that I couldn't do really what I wanted to do. So it kept me safe. It helped my psychiatrist to figure out what was going on, because we didn't know what was going on. My diagnosis actually got changed while I was in there, and I had multiple psychiatrists do second, third opinions, and my psychiatrist went to the rest of the psychiatrists and, like, the board, and talked to them about my case because it was quite complex and serious. They even did that to make sure that they were treating me the right way and, like, diagnosing me with the right thing. So I got diagnosed with schizoaffective disorder, bipolar type, whereas I just had bipolar before. So my diagnosis changed. The other thing was that they had to sort out my medication because my meds were not working. And then I also did this treatment called TMS, which helped with my depression because I was in a bad depressive episode by the end of it. So I was in there for 6 months, so that's a very long time. If I ever have to look at those flipping 4 walls again, I don't know what I would do. Yeah, but those were the pros, and, like, you could get extra medication if your doctor had written it on your chart, your med chart. I would say the cons would be that obviously you're away from your house, like your home, your family, your friends, unless, you know, they come to visit, or you're allowed leave and you're allowed to go out or to go home for a bit. But yeah, you know, I was away from my cat and my family. You are limited with where you can go. You can get extremely bored. You can be triggered by other people with their mental health issues. So it can be quite triggering or distressing because other people may be having meltdowns or doing behaviors that are triggering for you, or talking about things that are triggering. So that can be very hard. I found that very hard because I was very ill and people would be doing things or behaving in ways and it would really trigger me, or distress me. The other downside is that a lot of the time I felt like the nurses and the staff weren't actually educated enough or trained enough. So with me, because I had psychosis, I was experiencing delusions and hallucinations, and none of the nurses knew what to do with me. My psychiatrist did, but the nurses really didn't know what to do, and they would just kind of try to push medication at me. So I think a lot of the time, a lot of us would end up over medicated because the nurses didn't know what to do, or they didn't have time to help, like, to sort out what was actually going on, so they kind of just pushed meds at you, and stuff like that. Like, there were some really good nurses that were amazing, and I would go to and talk to when they were on, like, rostered on. But yeah, so that was a downside. Another downside would be that you can become too used to the environment, and then because you're in there for so long, and then it's very hard to readjust to coming back out of that environment and out of that place, because you're not having to, like, apart from, like, shower, like, you're not really having to look after yourself. Like, you're not cooking, you're not cleaning, you're not doing anything normal. Like, everything's being kind of done for you, and the other end, like, yeah, it's just, you're not in your own bed. Like, you know, there are just numerous things that could be cons, I suppose. But overall, I would say, would I regret going in? No, because I was very unwell and I couldn't function in society. I could no longer function in society, and I could no longer make decisions, and I was very unsafe. So I had to go in. There was no other option. It didn't matter whether it was public or private. I had to be in hospital. So I don't regret going in, but it was an extremely tough time, and it was so difficult for me and for my family and stuff too. So but I do think overall it definitely did help, but it was just, you know, it's one of those situations where you just have to do it, but it isn't necessarily the most fun thing. But yeah, I hope that cleared up some questions. If you have any more, please leave them down below, and I will see you in my next video.